Hi, my name is Abdul. I'm 27 years old. I'm from Sheffield and I've decided to get a penis filler.
I'm Stuart. I'm 36. I'm from South Wales and I want a bigger penis.
Men are no longer taking the surgery route to change their penis.
Any size is normal, any size doesn't shock me or whatever.
Injections with fillers are on the rise.
As we have different sizes of lips and breasts, it's the same with the penis.
But it's not without problems from people doing it themselves.
A lot of the time we end up having to remove the whole penile shaft skin and regraft it with skin from elsewhere in the body.
There's been an extraordinary jump in men getting penis fillers to increase their size, injecting liquid into the soft tissue under the skin of the penis shaft. We've discovered two of the largest male cosmetic surgery groups have seen a 20-fold increase in the number of penis fillers they've been performing in 3 years. Meanwhile, the number of penis extension surgeries are falling. We wanted to find out why the filler procedure is becoming so popular. So we came to Caerphilly in South Wales to meet 36-year-old Stuart, who's planning his first filler.
How did you go from thinking, I'm fine, to I want a penis filler?
I don't think I actually do need it done, but like, I think it gave me a bit more confidence and like I feel a bit more better in myself, and like I watch like Naked Attraction on TV and some are a bit bigger than others and some a bit bigger than mine, some a bit smaller than mine, but I just think I'd feel a bit more better if mine was a bit bigger.
What did you see that you went, right, yeah, I'll have that done? What was it?
I was looking online.
Right.
I was looking for a hair transplant.
Really?
Yeah, because I'm going quite bald on top, so...
right.
But then, like obviously then, I was looking on my phone and this thing, penis enlargement surgery, popped up.
So I can't imagine it's cheap having this done. What's the damage? How much does it cost?
£3,500.
A lot of cash.
Yeah.
And how long will it last?
I think about a year and a half maybe.
And then you've obviously got to have a top up after a year and a half.
Yeah.
Is that affordable? Is it worth it?
Well, I think like obviously if it makes you feel a bit better and you feel better in yourself, why not? Yeah, just have a go, but there is like a more permanent option then which you could go and have like the fat transfer. So I did look at that afterwards, so I thought if I see how it goes like this, and maybe that might be a second option then for me in the future.
It seems more men are wanting to change the shape of their penis, but it's how they're doing it that's new. What was once surgery with weeks of recuperation is now a filler in a walk-in clinic like this one.
You can't inject just into the penis.
Yeah. So, Dr. Greta, explain to me how this procedure works.
It works really simply. You get an injectable filler. We use hyaluronic acid, which is a natural substance, which is a dermal filler used for facial enhancement, for wrinkle, and you just inject that filler into the penis. It's injected subcutaneously, under the skin basically. So it won't affect erectile tissue.
As more men are doing this, do you think in some way clinics are playing on people's insecurities and making money out of it?
I can partly agree on that. However, if you choose a well-known professional clinic, you know, it would never play on that. It would just try to bring out the best of you.
Cosmetic non-surgical treatments like fillers have little regulation in the UK, but clinics without trained medics performing the treatments will struggle to get medical insurance. Other professional fillers include a Lance, a new type of filler also used in your face that has longer lasting results of between 2 and 4 years. Body fat can also be used. So why has the procedure suddenly become so popular?
Celebrities doing cosmetic surgery, people who then feel that they need to match these individuals and gradually develop a body image issue in order to try and develop confidence.
If someone came to you and said, right, I'm thinking about having a penis filler to increase my girth, what are you going to tell them?
I'd try and discourage them from having it. Then I explain to them that, you know, all of these augmentation procedures are mainly to increase your flaccid length, and it'll have no benefit on your erect length. So functionally, it's not going to improve matters. If anything, it might lead to complications that will impair their sexual function later on.
An NHS-backed study looked at the penises of 15,000 guys worldwide. The average, professionally measured, turned out to be 5.1 inches long when erect. Only 5% were longer than 6.3 inches. Just a very, very small number had what's called a micro penis, defined as less than 3 inches when erect. As for girth, well, they measured that too. The average flaccid penis was 3.6 inches and 4.6 inches when erect. The two leading men's penis clinics claim to be getting around 700 inquiries a month and performing over 130 procedures in the same time, although some are repeats. Most of those procedures are using hyaluronic acid, which lasts up to 18 months. One of those people who's going back for a girth top-up is Abdul, a 27-year-old delivery coordinator from Sheffield. This time he's going to get an extra 10 millilitres, which he says is a present for his girlfriend.
You don't feel a bit ashamed of when you're in the gym and you see, you know, like males with nothing on, and you just and you're one of those guys that, you know, has to hide. So there comes a point where as soon as you get used to it, you know what, I got nothing to hide no more. So in that sense, even you weren't even doing that before. You kind of hiding before in the lockers. Yeah. But now, if you've got a towel around yourself, you just, well, okay, then you've got nothing to hide anymore. You know, like you feel that's what I mean. You get a big boost from it. When I had it done, within a couple of days, I was a changed person, you know, like I was feeling much more confident about myself. Anywhere that I went, if I saw any sort of women or something, I'd easily approach them. When I first had it done, I thought, you know what, I'm not going to get it done again. I thought, you know what, leave it as that. Let's just be calm now, you know, it's nice how it is. But within call it about a year, maybe a bit more than a year, I just thought to myself, you know what, maybe one more won't hurt. You know, like, I'm not going to go over the top.
Could you have not done something else? I don't know, like changed your hair, gone out?
I could have done, and I have done, but it doesn't last. It does not last, honestly. Like clothes, they just here, you know.
But this doesn't last.
It lasts for longer than the clothes, it lasts longer than cars itself. It gives you a boost.
You are in the normal range.
Yes.
So why do you feel the need to do that?
It don't make me happy. For some reason, and I don't know, and I've done it loads of things. Like I've even like had like a Lamborghini for like a week, you know, just to see what that feels like. And I've done it. I've even bought loads of different clothes, took my missus out. You know.
A penis filler.
Yeah, but for some reason that does it. Yeah. You know what I mean? Everyone's different.
This is Dr. Greta.
Hi Greta.
Hello, how are you?
I'm fine.
Just come and have a seat.
Stu and his girlfriend Karis have arrived in Doncaster for the procedure.
Stuart's here today for 15 ml of HA.
Do you have any questions related to the procedure?
I'm just worried that it's going to be a little bit too big.
In your case, as you are opting for 15 milliliters, you will notice a decent change.
When it's done, will it look normal?
Yes, but it will take a couple of days, sometimes even a week, for the swelling, firmness to be reduced. Anything else? Yep.
Right, Stuart, we just need to take some pictures, some before photographs, if that's all right. This is going to be good.
Before the needle goes in, Stu's had some cream to numb the area.
I will inject just underneath the head of the penis. We are using a short, sharp needle. You may feel a little bit tension underneath your skin.
For men these days. got confidence issues, which Stuart had because he was quite a big person before, so obviously his self-esteem is quite low. So I can't really say anything.
You've gone from 12.5
to 15.
Yeah.
2.5 inch.
Oh my
Oh my god.
2.5 centimetres.
2.5 centimetres.
It was time for Abdul to come in for his treatment.
So the big day's here. How are
It
you
is,
feeling?
yeah. Feel quite good, to be honest. Feel quite excited, thinking that there's going to be a change coming. So I'm looking forward to the change and to the new, call it the new me, if you like.
He's getting 10 millilitres of filler in his penis.
So it's no sets for 1 month, so that everything can get into position. So when you try to rush this sort of stuff, you might get complications with it, and you don't really want any sort of complications.
It looks slightly scary,
Yes.
but that's not like it is, yeah?
Tonight, you're going to go home, you're going to see your girlfriend. Is tonight the night that you tell her that you've had it done, or are you going to leave it a few days?
No, tonight would be the night. Kept in the dark long enough. I think it's about time, obviously, we let the secret out.
What's the most you've seen, and have you ever seen someone putting in too much?
Yes, but according to good medical practice, we should suggest the patient what's right for him.
That's the big moment, I suppose, the time we
reveal.
we measure how much bigger it's got.
It was 10 and now,
11.5.
yep,
So it's got about 1.5 centimetres.
yep.
Nice.
Yeah, you happy with that?
Yeah, definitely.
Yeah. Don't knock it now.
We'll take some more pictures.
Yeah. Of course, here we have a sterile environment with trained doctors using approved medical fillers. But urologists are seeing problems from more people performing their own DIY fillers. And yes, that's DIY down there.
Dr. Asif Munir is the man many patients end up speaking with in the NHS to sort it out.
A lot of them will have done it and will present a few days later when they realise that the outcomes aren't as they expected, in which case we have to initially treat any underlying infection and then plan for surgery to either debride any dead tissue or remove some of the filler. A lot of the time we end up having to remove the whole penile shaft skin and regraft it with skin from elsewhere in the body.
How much of a concern is this becoming for your association?
We're seeing an increase in number of individuals who want to either self-inject or using fillers, self-injections, and they're not aware of the complications of injecting things like Vaseline, various oils, silicone. They all cause a major tissue reaction, and the expectations are unrealistic.
While some people are having to deal with major complications from fillers, for Stu and Abdul at the clinic, their concerns are more about abstinence.
You gotta let time be the healer in this sort of scenario, because if you rush these sort of things, you might make more complications, and you don't really want any more complications with this sort of stuff, especially with a private part.
It looks a bit, yeah, it looks a bit deformed at the minute. It's okay. I thought it was going to be a lot bigger, but no, it's fine.